Well, as South Africa joins the world in the annual commemoration of World AIDS Day, we take this time to review the country's progress in its fight against HIV and AIDS. A survey conducted by the Human Science Research Council found that there were about 7.8 million people, or 12.7% of the population, living with HIV in South Africa in 2022. Now, the study, which was conducted in 27,000 households throughout the country, is to provide information on national and subnational progress towards controlling the HIV epidemic in the country. Research Director in the Public Health Societies and Belonging Research Division of the Human Sciences Research Council, Professor Sizulu Moyo, joins us now to discuss some of the findings. Professor, thanks for joining us. It's good to have you on the program.
Viewers, and thank you very much for the opportunity to speak to you today on World AIDS Day.
So, Professor, let's just dig in straight away to the survey. So, about 7.8 million, or 12.7% of the population, are currently living with HIV. When we look at these numbers, how far would you say we have come as a country? Are things getting better or worse from what you've seen?
Thank you. Just taking from some of the concluding remarks that were made when we launched the summary report on Monday, on the 27th, there is some good news. In fact, there is quite a lot of good news from what this survey is showing us. We see from the data that we have about 100,000 odd less people living with HIV than we had in 2017 when we did the previous survey. And when you look at the trends over time, we see a trend that indicates that our HIV epidemic is reaching a plateauing phase. So we are no longer really having that increase in the total number of people living with HIV. What is also interesting is that we see a shift of the curve, what we call the epidemiological curve, to the right, meaning that we have many people who are living and surviving well late into their older ages in life, living with HIV. And this is testament to the treatment that is now available, the effective treatment that is available. And if I may continue on that point, what we are seeing compared to the study that we did in 2017 is that we have many more people who are virally suppressed. We know that viral load suppression is critical if we want to stem the ongoing transmission of infections amongst those who are already HIV infected. So we're seeing about 81% of people living with HIV at a population level who are virally suppressed. In 2017, the comparative statistic was about 62%. So definitely now we have got many more people living with their viral load suppressed, and we're really looking forward, projecting that we're going to reach the targets that are required for us to end HIV quite soon, as predicted and as required in terms of the 95 UN AIDS targets.
Okay, so I mean, yes, indeed, some good news to look at, and I mean, just that comparison again, for viewers that sort of may want to know where we've come from. So 2017, we had 14% of the population that was HIV positive. Now we're at 12.7. So in the figures we can see that. However, and there is a big however, let's dig a little bit deeper into the study. And the study did go into the groupings of males, females, and also in different age groups. What worried me and stood out for me was the prevalence in young girls, particularly. I saw that figure being quite high. Perhaps you want to go through some of the elements in those focus areas.
Yes, I think that in South Africa, also in other Southern African countries, we know that we had identified that one of the largest population groups affected by HIV were adolescent girls and young women. In fact, our data from previous studies had shown us that the rate of new infections was highest in this age group. Now, in this particular study, we're still analyzing that data of new infections. But what we also see a very high burden of HIV in this population group. And what is also of significance is that we see a discrepancy between adolescent young boys and adolescent young girls. And so we see a much higher burden of HIV in adolescent young girls and young women. And this is something that has been well known. And we also know that there have been interventions that have been directed at trying to address this. One of the key issues, which we've shown also before in previous data, is what we call age-disparate sexual relationships, where also if you look at the HIV prevalence according to the age groups from the data that we presented, you can see that it does indicate that there are sexual encounters between older men, where the HIV prevalence is higher, and also younger women, where their HIV prevalence seems to be matching. So this is one of the things that we really need to focus on. We also know that women in general, just for various reasons, biological reasons, social reasons, we also know issues around gender-based violence, that all these put women, and especially young women and adolescent women, at greater risk for HIV. And so this is something that is worth noting, and it's also something that really points us in terms of what needs to be done, where do we need to strengthen, what do we need to do better, so that we may begin to see a dent and a change in the burden in this particular population group.
And I mean, you know, to put it into perspective, and it really does need perspective as to how dire the situation is, it is twice as high in young girls compared to males. HIV prevalence in the age groups 15 to 19, it's 5.7% in that age group for women, and for men it's 3.1% in the 15 to 19. In the ages of 20 to 24%, women are sitting at 8%. And 4% in men. I mean, this is very, very big. And then, of course, threefold in females between 25 to 29%, and that's very big. 19.5% in women versus 6.3% in men. So we talk about the fact that it's one of the biggest issues is, and we know this, older men preying on younger girls who are desperate for these so-called lifestyles and gifts and presents, and you know, they just sort of are preyed on them by these sugar daddies or whatever you want to call them. I mean, there's lots of words to call them, but the problem is this is where these diseases are spread. And we've seen this happening, particularly with young schoolgirls, young university girls, or just young girls fall pregnant and then disappear into the network and find themselves in the position like HIV, or even severe if they don't treat it. I mean, are these the stories that you're hearing all the time and seeing?
That is correct. And I think that this evidence is just underscores what we have seen before, as I have said. But what is encouraging, I think, is that the data is there to help us act. And also what is encouraging is that the new NSP, the National Strategic Plan that guides the country's response to HIV, to TB, and to STIs, really speaks around these issues. It speaks around the vulnerabilities, the social, the structural barriers that are essential for us to prevent new infections. And so issues around awareness, around empowerment, around sexual and reproductive and health rights for these particular age groups, and taking this multi-sectoral approach will help for us to focus and address this. We've already seen some progress. When you think about, programs like the DREAMS program, we had all these programs that have targeted adolescent girls and young women. Yes, it will take time for them to yield fruit, but we are aware of the problem, and our strategic direction in terms of response is targeted, addressing this from a multi-sectoral point of view. And so we look forward to some of the proposals that are in the NSP that will really target some of these issues that increase the vulnerability of this particular age group.
I want to just quickly also dig into the provincial report as well, and the prevalence in different provinces. So, from what I'm seeing on the map, we can see that the lowest prevalence of HIV is in the Western Cape, and the highest prevalence is in KwaZulu-Natal, followed by Mpumalanga, then the Free State, then the Eastern Cape, and then, of course, around that we've got the other provinces. But certainly KwaZulu-Natal is the one to look at this point in time. Is there a reason where, and why? Obviously, population is one thing. I mean, the Northern Cape is surprisingly slightly above the Western Cape. I mean, there are less people living there. But just in terms of a geographical movement in South Africa, what do we look at into that? What do we need to do in terms of that? And what does it tell us?
So we've known for quite a while that KwaZulu-Natal is actually the epicenter of HIV and also TB in the country. What is encouraging is that the response in the province has been very proactive and has been very effective. Although we have got this high proportion of people living with HIV in that particular province, the response in terms of increasing access to treatment, in terms of maintaining people on treatment and virus suppression has been quite good. That province actually has the highest level of population level viral load suppression. So that is something that is to be commended. So this is something that we continue to need to work on in that particular province. We know that in South Africa, there is quite a lot of migration between different provinces. We know that there's quite a lot of migration between KwaZulu-Natal and also Gauteng in particular, and it's also KwaZulu-Natal and also the Eastern Cape. But we also know that some of the areas in KwaZulu-Natal, we've got quite a lot of rural areas. And so it becomes important in terms of services, reaching those people for the government there to respond and to be able to reach everybody who needs treatment. So the data, while showing us and acknowledging that KZN is the epicenter of infections, the response has been proportionate, I feel, because we're seeing very high levels of viral load suppression, which is what we need. And we project that to continue with the commitment that is there. That program.
All right. Professor, I'd love to get into it a little bit more, but I'll leave it there for now. It certainly seems that, in part, the things have quietened down with regard to HIV and AIDS. There's still a lot of work that needs to be done, and we need to sort of delve a bit deeper. But just in terms of what the country's looking like, I think you've given us a very good picture in terms of that, and we thank you. That's the HSRC survey, the HIV survey, long awaited in terms of just seeing where South Africa is and delivering those to us from the HSRC as the Director in Public Health Societies and Belonging Research. That was Professor Moyo. So it was good to have her here on the program.